Can hair fall happen after hair transplantation? This is a question which is frequently asked. Now, to explain this, I am Dr. Venkataram Mysore, hair transplant surgeon, dermatologist, Venkat Center for Skin, ENT and Plastic Surgery, Banashankari, Vijayanagar, Cunningham Road, Bangalore. Can hair fall occur after transplantation? Can hair shedding happen after transplantation? Can hair loss happen after transplantation? Can baldness happen after transplantation? Each of these is a different question and needs different answers. Let us take the first one. Hair shedding, can it happen? Yes, it can happen. What do you mean by shedding? The grafted hairs which are put to the bald area, they settle down in about a week, and in the second week the shaft is shed temporarily. The new shaft is formed which reaches the surface by 3 months, then grows 1 centimeter a month. So this temporary shedding after transplantation is very common, happens in everybody. It is explained to the patient. There is nothing to worry about it. This is also the reason why, whether it is long hair transplantation or short hair transplantation, this will happen, shedding will happen. So there is no great advantage of doing long hair transplantation. Can hair loss happen after transplantation? Hair loss can happen in the existing hair after transplantation. The grafted hairs are said to be permanent, which means we take the hair from here, which is the permanent hair, as you can see in this diagram. You look at stage 7 also, you can see the occipital hair being there still intact. Those hairs are androgen resistant, they don't fall, but the remaining hairs in this area can fall, baldness can extend. This is something which every patient has to understand. That is why we educate them that they should take medicines to preserve the existing hair. If somebody does not take medicine, their baldness can extend over the remaining existing hair area and that hair can be lost. This is definitely possible. So everybody should be willing to take medical therapy even after transplantation. So that is the second question. The third question, can baldness happen to the grafted hair? In other words, can grafted area become bald? Now, this is very unlikely because the grafted hairs are supposed to be permanent. However, in science there is always a caveat. However, what do we mean by permanent hair? Permanent hair refers to, look at this diagram, the central part of the occipital scalp, this area. Anything above that and below that, those hairs are not safe donor. Only the central part is safe donor. So now if somebody were to do FUE, large session, 4000 grafts, they will take it from this entire occipital scalp, including the non-safe donor. In such a case, the grafted hair may also undergo thinning. This was uncommon earlier because the session size was small. As long as we are restricted to about 2,500 grafts in one session, this doesn't happen. But if we are aggressive, if we yield to the patient's demand, if patient is greedy, if doctor is greedy, then if we try to do 4,000, 4,500 in one session, then if you take from the non-safe donor, then those hairs can thin out and you will lose the hair. So, how to prevent this? Contact the right doctor, make sure that you are educated well, make sure that the doctor follows ethical guidelines, and then this won't happen. Now, there is one last possibility that I have to warn everybody. There is a type of baldness called diffuse type of baldness or DUPA. In such a case, the donor area is also thin. There is no safe donor in such patients. That is a very rare occurrence. Those patients start balding very early, very young, they are obese, they may have diabetes, they may have other hormonal issues. In such cases, the donor hairs are weak, so hair transplantation is not a good choice for them. They need proper medical treatment, and that needs proper diagnosis by the doctor and proper treatment for the patient. So, to summarize, hair shedding temporarily after transplantation is common and occurs in everybody. Nothing to worry about. Hair loss of the existing hair leading to future baldness can also happen, but you can prevent it by taking medicines properly. Baldness in the grafted area of the grafted hairs is rare, should not happen if the safe donor concept has been adhered to. And there is a rare category called diffuse pattern hair loss who is not a good candidate for transplantation. So, the summary is also that you should contact a experienced doctor, well informed transplant surgeon who practices ethically as per standard guidelines and understand what is possible, what is not possible. Understand the need for holistic management, drugs, biological treatment, platelet-rich plasma, and transplantation. I hope you have liked this video. If you like it, please share it. Please contact us to give more ideas. Visit our website venkatcenter.com. I am also giving the link of one article for the holistic management of hair loss called Systematic and Rotational Therapy of Androgenetic Alopecia. Thank you so much. Good day.